Nearly 120,000 South Carolinians 65 years or older will be living with Alzheimer's by 2025.
Now state lawmakers are working to create a statewide plan to address what some are calling a crisis. News 19's Becky Buzz is at the State House now with more.
The last statewide Alzheimer's plan was released in 2009. This proposal would task an advisory council with creating and implementing a new plan every 5 years.
People see it, but you never know it until you live it.
Republican Senator Katrina Shealy's husband was diagnosed with Alzheimer's 7 years ago.
It is a very personal disease for anybody that's a caregiver.
He's one of the 95,000 residents living with the disease in South Carolina. As the number continues to rise, Shealy is working on legislation that would create a statewide plan designed to address the issue. The first report would be released this fall and updated every 5 years. They'll get input from nearly a dozen agencies and medical organizations to find ways to combat the disease and to get resources to those who need it.
We need to keep ahead of the situation, not always be behind it.
Taylor Wilson with the State Alzheimer's Association says research has advanced greatly in the decade since South Carolina released its last statewide plan.
And there's more hope today that this is preventable, that this is treatable, that this does have an end, that the science is going to lead us there. And that's not reflected in the 2009 plan.
Wilson adds South Carolina is the third largest neurology desert in the country and only has 66 practicing geriatricians. She says this proposal will help fill those gaps.
How do we increase access to clinical trials? How do we recruit more researchers to South Carolina? How do we improve clinical trial participation and the ease of access? All of that stuff is in the state plan.
Legislative liaison for the State Department of Social Services, Connolly Ann Ragley, hopes this legislation will help educate people about the disease and get more resources to caregivers.
State plan and a state plan that is updated regularly is really going to have a benefit on the families of South Carolina, not only the patients, but also the caregivers.
The bill is being taken up by the Family and Veterans Services Committee on Wednesday. Representative Mark Smith is sponsoring an identical bill in the House. Reporting at the State House, Becky Buzz, News 19 WLTX.
Becky, thank you so much. Taking a closer look at Alzheimer's in the state, numbers from the State Department of Aging show more women are impacted by the disease than men. Women make up 63% of South Carolinians with Alzheimer's or related dementia diseases. And according to USC's Office for the Study of Aging, 11% of the population of South Carolina ages 65 and older have Alzheimer's or dementia. For residents 85 and older, that number jumps to 51%.